On Tuesday, July 30th, 2024, I finally had my surgery for a right midfoot chronic Lisfranc dislocation, and at this point I had had my injury 5 years and 8 months ago. I had tried pretty much every other form of treatment possible before getting my surgery, and I had seen another surgeon before seeing the surgeon that I had decided to go with, and just finally decided to go with this type of surgery, the midfoot fusion. And it was pouring rain when we left the house. Thankfully, the rain calmed down by the time my husband Matt and I got to the hospital. Parking was pretty easy. We were able to get some steps in from walking to the car to the hospital. Matt and I checked in at 7:45 in the morning, 3 hours before my scheduled surgery. I was allowed to drink clear liquids until 3 hours before my surgery, so I drank about half a liter of water on the drive to the hospital. I had also had some Diet Coke for caffeine before leaving the house because the hospital had said that that would be fine as well. Once we got there, we had about an hour to wait before I got called back, which gave me time to get in some more steps and enjoy my last moments of mobility before the surgery. My foot, ankle, and lower leg all the way up to my knee were really hurting though, and so I really wasn't moving around as much as I would have liked, and I was also having quite a bit of numbness all the way up to my knee as well. I was really excited for the surgery because of all of the pain that I had been having the past couple of months. It had really increased compared to the past couple of years. I needed DDAVP for a platelet dysfunction that causes my blood to clot slowly even though my platelet count is normal. That was administered by IV and took about 30 minutes. Thanks to the medication, I lost very little blood during the surgery. Everything was running a little late, but that was honestly to be expected. Next, the surgeon came to talk to me and to mark which foot was getting the surgery. I got a nerve block injected just above my knee on both sides of my right leg around 11 a.m. They said the nerve block would last anywhere between 6 to 12 hours. I had general anesthesia in addition to the regional block. During my surgery, my husband said that he saw the largest dog he has ever seen in his life at the hospital while he took a walk. According to the surgical report, my surgery was a right midfoot fusion involving 2 separate joints through a single incision. The surgeon also performed a bone graft using bone from the side of my heel. While I was in the recovery room, the surgeon let my family know that my surgery went exactly to plan. He let them know that I had a plate and 4 screws installed in my foot for the midfoot fusion, and he let them know that a bone graft had also been needed. The surgeon's exact wording to my family was that before my surgery, my foot was completely unstable, but now my foot was completely stable. Details from the report added that my foot was clinically unstable within the midfoot region and had collapse of the midfoot. Due to the complexity of my injury, it was noted in the report that 2 providers were needed for the procedure. Possible complications from the surgery that had been discussed with me and that were also noted in the report included infection, bleeding complications, wound healing complications, stiffness, painful scar, nerve damage, and need for surgery. These were all reasons that I had tried more conservative options before getting surgery, but since my foot had been getting so much worse, I was more than willing to take the risk at this point because of the level of pain and difficulty functioning that I was having. My husband was able to pick up my prescriptions at the hospital after speaking with the surgeon, which were antibiotics that I needed to take for 24 hours after the surgery, daily aspirin while non-weight-bearing, and painkillers. There he met a German Shepherd in training to be a service animal in line at the pharmacy. On the way back from the pharmacy, he picked up a coffee from me from the hospital Starbucks. I remember getting out of surgery and the nurse telling me that my loved ones were going to be getting to see me soon and that my husband was picking up my Starbucks. The hospital staff all seemed surprised that I had so many people who were both calling me and who were also there in person at the hospital with me. I honestly have the best army of support in my life. I do not know what I would do without them. We were able to leave the hospital a bit before 4 p.m. and the car ride home was a little easier than I thought it would be. Matt was a great driver and he took the route with the least turns possible to make it as smooth a ride as possible. It was definitely still exhausting though, and getting out of the car and getting up the 3 steps of our back porch and getting into our house was very disorienting. Making the sharp turn into our kitchen was also difficult, and I needed Matt to stand behind me to help keep me stabilized. Then I had to pause once we were inside in the kitchen because I was starting to feel really dizzy. I finally made it to the recliner in the living room, and that's basically where I stayed for the next 7 hours. I don't think I moved at all other than to wiggle my legs around for circulation until it was time to go upstairs to the bathroom and to go to bed. I was too exhausted and disoriented to move around or to take my shower, and so I just went right to bed. Matt did a great job of keeping me hydrated until it was time to go upstairs. I remember Sophie calling me when I got home to check on how I was doing after the surgery and talking to her for a while. Some things I noticed at home the day and evening after my surgery were, first, even when I did start having pain in my foot in the evening, the nerve block that I got around 11 a.m. did at least help a little bit through the entire evening and the beginning of the night. Two, it was good that the nerve block continued to have some effect, even though it was reduced, because I got a headache from the anesthesia that turned into a migraine, and I was worried about mixing migraine medications with the pain medications for my foot. With the nerve block still helping some, I was able to take care of the migraine and allow the migraine medications to take effect and wait long enough for it to be safe to start taking the opioids for my foot. Even though my foot was definitely starting to hurt more by the time that I did take my first painkiller for it, it was much easier to function and take care of everything foot related without the migraine going on. Third, the stairs were not my friend at all the day of the surgery. In fact, they ended up being my enemy for a while after the surgery. My house does not have a bathroom on the main floor, and fortunately, I didn't need to use the bathroom for a while after getting home since I was in no shape to move when I first got home. But when it was finally time to go upstairs to bed, it was rough since I was completely non-weight bearing and had just had the surgery and was just trying to get rid of a migraine. Thankfully, Matt was very patient with me. He stood behind me to keep me stabilized and to help me up and paused with me every 3 to 4 steps because I would get so disoriented from every movement. I was so worn out from the stairs and everything else that I was not able to shower that night, which really bothered me because all I wanted to do all afternoon was shower off the hospital smell. But once I'd used the bathroom and brushed my teeth, I was honestly too exhausted to do anything at all other than just go to bed for the night. So that first day of the surgery was definitely just a blur. I took notes on what was going on the day after, and if it was not for those notes, I honestly would have had no idea what happened if I didn't have those to refer back to, in addition to what my family and my husband told me. I was just in such a blur recovering from the anesthesia and getting that migraine that I just had no memory at all of what happened afterwards. And I have to say that was something that is really odd to me, is just not really remembering the day at all afterwards.